There is something happening in Alberta right now that should concern every single Canadian. Danielle Smith's Bill 11 is the most serious attack on public health care our country has ever seen. It opens the door to an American-style two-tiered healthcare system where your ability to pay determines how quickly you receive care, and that violates the principles of the Canada Health Act. And here's what should outrage all of us. The federal government has both the authority and the responsibility to enforce the Canada Health Act. It isn't optional. Yet Mark Carney and his health minister have made it clear they will not defend the Canada Health Act. They will not defend the law. They are choosing to stand by while Danielle Smith breaks the law of this country. Canadians expect the federal government to uphold the law. Canadians expect the federal government to defend our public institutions, and Canadians expect the federal government to stand up for our public healthcare system when it is under attack. The Canada Health Act is not a suggestion, it is the law. And when the Prime Minister chooses not to enforce the law, he is sending a message that the rights and protections that Canadians depend upon are optional. The Canada Health Act was designed to set a national standard so that no matter where you live in this country, you can count on medically necessary care based on need, not your ability to pay. And if the federal government refuses to enforce its own law, then the protection from that law means nothing. This isn't leadership. This is abandonment. As the only member of parliament from Alberta fighting every day for public health care, I refuse to stay silent while both levels of government dismantle one of the greatest achievements in Canadian history. Because public health care is more than a program. It is a promise. It is a promise that no matter where you live, no matter how much money you make or what challenges you face, you will receive the care you need based on medical necessity, not the size of your bank account. And by refusing to enforce the Canada Health Act, Mark Carney's government is telling provinces that they can ignore federal law without consequences. And every premier in this country is watching. In particular, Conservative premiers like Scott Moe and Doug Ford are watching Alberta very closely. They are watching to see whether there will be any consequences for violating the Canada Health Act. Because if Alberta gets away with this, others will be encouraged to follow the same path. What starts in Alberta will not stay in Alberta. It will spread across the country. It will fundamentally hurt the health care of every Canadian. And for those who think giving Danielle Smith whatever she wants will somehow reduce separatist sentiment, they're wrong. People believe in Canada when Canada works. They believe in this country when our shared institutions deliver for them. And public health care is one of those institutions. The Canada Pension Plan is another. Protecting them is how we strengthen our federation. Allowing them to be dismantled piece by piece is how we lose our country. So I have to ask another question. If Mark Carney is unwilling to defend Canadian public health care against Danielle Smith, will he defend it against pressure from the United States? As CUSMA negotiations continue, we are already seeing American corporations, especially private health insurance companies, moving into Canada's healthcare market. If this government won't stand up for the Canada Health Act here at home, what will stop them from putting our public healthcare system on the negotiating table? Canadians deserve an answer. Because once public healthcare is broken, rebuilding it will be far, far more difficult than protecting it would be today. I will keep fighting for Medicare. I will keep fighting for the Canada Health Act. I'm not going to stop standing up for public health care, for a system that Canadians have built together and deserve to pass on to future generations.